we'll get it going.
Okay, welcome to another episode of Inside Out Med.
Let's get it going.
We're starting today with some interesting developments in the med spa space. Why don't you get that rolling about Ideal Image?
So the biggest leader in the game right now, Ideal Image. You know what's crazy? So they bankrupted their Canadian companies in 2023. I found that out.
Oh, I didn't know that.
Yeah, so they started closure of the Canadian ones in 2023, and now they're selling off all of the United States ones. And basically, they just filed an employment act, it's Warren Act, where if you have a certain amount of employees, you have to give notice before you just close down HQ, and their Tampa headquarters is officially closing down.
Yeah, apparently they initiated that December 22nd.
Yeah, and I called a couple clinics, and they won't sell you packages anymore. Like, you have to just buy single treatments, because then it'll affect the purchase price of that sale, of course, which is smart for whoever's negotiating that deal. Forever Young just acquired one in West Palm Beach. I saw that.
Mm-hmm.
So they just
There's a couple other med spa / laser centers that have acquired some locations as well.
I
right?
think Sev's a big one that's trying to acquire at least maybe the equipment, but I want to know why.
Yeah.
You know, and as we both know, if without the right team and the right infrastructure, it's very difficult to own a business, let alone a medical practice. And I think that's what it came down to. I think they were just, healthcare should not feel corporate, right?
They were getting too big.
Too corporate, right? So there should still be care in healthcare. We've discussed that. And this is just a wing of healthcare, right? Aesthetic medicine, regenerative medicine is just a wing of healthcare, making people feel better, look better. It might not be a need, but I could argue that it could be, because when you feel better and you look better, your performance is a lot better.
Well, they don't have the reliability of non-discretionary spending healthcare, like with reimbursable insurance, Medicaid, Medicare.
Of course.
All those kinds of things. You can run things really badly and still survive, because, at the end of the day, Medicare and insurance-based practices survive just based on billing a lot of the time.
Why?
Well, because there's no quality threshold you really need to reach. I mean, they do.
There's a quantity threshold, though, isn't there?
Yes, and that's easy to do because there seems like there's never enough doctors to go around, especially, I hear my patients asking, like, oh, I have to wait like 2 months to get in to see this doctor, or 2 months to get just a primary care doctor appointment. So
why is that?
I'm not sure exactly, but I think with the current legislation regarding Obamacare and stuff, they've basically cannibalized a lot of practices that have left the industry, have moved into other fields, just like aesthetic and wellness medicine, or have been turned to concierge medicine type practices.
Do you see that actually? All those so I mean, obviously urgent care, whoever I don't know who developed that, if it was an individual or if it was a group or a hospital that started with that idea, and then it kind of went out to like MD Now and stuff. But so they thrived off of that, right? So they saw a niche, and they were able to capitalize on that. And they do both, so it's insurance and cash pay. But what I'm seeing now in the market is you have some of these practices that are going like, ER services shouldn't feel like ER services, or like hospital services shouldn't feel like hospital services, and they're opening up practices just for primary care or emergency care, and they're all private. It's like all private individuals or groups that are attacking that industry. And I'm thinking it's more cash pay than insurance pay, based off of what I'm reading.
Perhaps, yeah.
One big one on the West Coast just opened up. Let's see if I can pull up the name of it. But it seems like they have some pretty big operations opening up for that type of medicine.
But at the end of the day, I mean, if you have for example, Ideal Image, they had, 275 employees at their headquarters. I mean, that's a lot of overhead just to manage all your locations.
You think that's sales, or what do you think that is?
I don't know. It seems excessive. So, from that standpoint, I don't think it was very well run.
They survived for a long time.
They
though.
did because, they didn't have a lot of competition, and I think they were...
Here, take a look at this. Soulless Health, right? I think that might be it. So you've got these practices that are kind of veering into primary care, or not practices, but people that are...
Well, yeah, this is just another kind of concierge type model.
Yeah. Why do you think that's becoming more popular now?
Because people can't get appointments with their
You
physicians.
think that's the full-on reason of it? That's what...
Yeah, and then when they do get an appointment, the doctor spends 5 minutes with them and pretty much neglects the majority of the issues that they should be talking about.
Why did healthcare get to that point, though?
Because of supply and demand. I mean, when you have intense demand and not that many doctors to provide it, and the doctors that are providing it have to reach us, like to see, say, 50, 60 patients a day. They're not going to be able to focus very much on the patients they do see. And then to get in to see those doctors, you're going to have to wait 2, 3, 4 weeks at least. And depending on the severity of your complaint, you might not have time to get in to see them. You have to go straight to the emergency room. And then that's a whole other issue, because you go to the emergency room for something maybe you don't need to go to the ER for, but you have to because, you can't get an appointment and you can't afford to go to an urgent care, or the urgent care you go to has poorly trained providers that are just going to send you to the ER anyways. So
that seems like a common recurrence.
Yeah.
You go to urgent care, they send you out, right?
Yeah, they don't want any liability. So if it's not like a cold or something basic, even if it's a suture, a simple suture, a lot of times they're not capable of doing that.
Why? Why do you think?
They don't have the providers with
yeah, but these are nurse practitioners and PAs. They should be more than capable to do it, no?
A lot of times they might have providers in an ER setting that are very competent. In an urgent care setting, they don't like to get too involved with anything like stabilization of fractures, reduction of fractures, any complex laceration. If a laceration repair extends beyond maybe 15 minutes, they're going to send it to the ER. They want to glue the suture site together. That takes five minutes to do and send the patient out. Or, based on laboratory values, which may be concerning, it may not be all that big of a deal, but if it's outside the normal threshold and they don't feel comfortable with high blood pressures or some abnormal finding on traditional blood work, they're going to send it to the ER because they don't want any liability. They don't want to be sued in the case of an adverse outcome if they treat the patient there and send them home.
It kind of blows my mind that's the model, but I mean, it's beneficial in some scenarios, just not, in my opinion, the majority. Back to Ideal Image, though, I think it was just improperly managed. I think that's what it comes down to, right? But how do you get to that point? Since we're in this is obviously a service-based industry. Healthcare is strictly correlates to service, and I think they just took that out of it.
Well, I think a business that was operating for a long time just based on, acquiring as many patients as possible, but the quality of service was very poor.
Do you think?
Yeah, I don't think they had some locations may have, but from what I've heard from a lot of patients, the quality of injectors wasn't that great. If there was a good injector or an injector that developed reasonable skills over a period of time, they left and opened or they went to a higher paying position somewhere else. And the quality of the equipment was dated. I mean, they had a lot of equipment that was quite dated. Their lasers, their body contouring equipment. They didn't replace it as new technology became available. And so they were, providing a lot of services at fairly discounted rates because that was their way to attract patients, and then not providing a very good service. And at the end of the day, with increasing competition, a business model like that is going to go bankrupt.
We had a couple patients transfer over from, I guess they were deciding between us and Milan Laser Hair Removal. Have you heard of them?
Mm-mm.
One of the patient coordinators had me hop on the phone with the patient to kind of dive into a little bit more of our complex lifetime laser hair removal plans for PCOS.
Mm-hmm.
And she was talking about how, she was talking to this clinic, Milan, and they were their whole sole argument on why not to choose Refresh for laser hair removal was because the individuals performing laser hair removal were electrologists and not nurse practitioners.
Really?
Yes. And it kind of blew my mind. I was like, okay, so their whole business model is nurse practitioners performing laser hair removal. However, just because you're a nurse practitioner does not mean you're more qualified than electrologists. I mean,
hair removal is a fairly monotonous procedure. I mean, once you become proficient at it, it doesn't matter what your training is.
Yes, but you have to become efficient at it, right? I mean,
exactly.
There could be serious.
And the ones in your place, that's all they do
all
day long. And
she ended up booking. She scheduled her appointment. Is going to do lifetime for her. That's the most beneficial plan because unlimited treatments, especially with a condition like that. And I was like, I was just like, if you feel like they might be a better fit, like, we can't pressure you into coming here. It's at the end of the day, it's up to you. Like, do your due diligence, like look into everything. And she was just like, I didn't like the way that the individual I was talking to positioned Refresh, so I'm gonna pick you guys. I was like, well, that really backfired. I just thought it was crazy. But
I mean, I think it's interesting they have nurse practitioners and PAs doing hair removal,
right? Yeah, there's a fine line between stuff, right? You have clinics that do that, then you have clinics that you've got estheticians and laser techs doing like tattoo removal and CO2 and stuff, which, so you have extremes on both sides.
Yeah.
But, I mean, their extreme is obviously safer, right? But if you are a nurse practitioner, I don't know why you would want to perform laser hair removal.
Exactly.
Right?
It seems odd.
There's so much more that you can be doing
with your
credentials time and your credentials and like being properly trained. I don't know how that's, I don't know how a nurse practitioner would, get into an employment contract knowing that I'm going to be doing a lot of laser hair removal.
Yeah.
Because it takes up a lot of time.
And it is very boring.
I mean,
it's very boring. I can't think of anything I'd rather not do.
So, I mean, obviously the electrologists love it. That's what they know. They do everything skin within they're in their scope, but a nurse practitioner can do a lot, right? From an aesthetic standpoint and a wellness standpoint.
Exactly.
Like with the right pieces of equipment, modalities, training, and they're choosing to do laser hair removal.
Yeah, I mean, that's suspect on its own. I don't know if I'd want a nurse practitioner doing hair removal because there's something wrong there.
Yeah, it didn't make sense to me. I was just like, I guess there's a lot of different. You could do a lot with the Candela, right? And just like you can do a lot with the Fedona or the Tetra Pro, the Helix, all these devices. So maybe they just wanted to cut out liability and be like, well, they can use any of the devices. But I don't even know if they offer anything like ablative like that or fractionated to where they would be utilizing a mid-level for that type of procedure. I don't know if they do that. There aren't a ton of practices out there that I've seen that are performing CO2 the way we perform it.
No, they're not. Usually it's going to be plastic surgeons that do that kind of stuff.
Yeah. It's and in my opinion, it's like you're robbing the patient, right? Like you should be able to treat, like you should know how to treat. And like if if you need to go ablative on a patient, like you should be able to perform a procedure ablative, right? And a lot of these practices out there, they're like doing Cool Peel and stuff. Like Cool Peel is a great branded name, like they have really good recognition around it, but like a Cool Peel even requires different settings based off of the patient. Like I'll see some patients that come out, and they're doing Cool Peels, but they all look very different. Like if you take every Cool Peel that we've ever performed, every patient looks very different on terms of downtime. It's
Yeah, I've
because the
noticed that a lot.
settings are completely different.
You'll also see that patients that have done more treatments or have less downtime with their skin tends to adapt. But
How many would you do it? Like if you were to perform an ablative laser procedure, after that, how would you keep up with it? So let's say patient, when you're going that ablative, I mean, it's usually like above 40, right? Most of the patients are above 40, unless they're dealing with like some really abnormal skin.
of course, it
like
depends on the age of the patient.
Let's say the patient's above 40, like late 40s, ablative laser procedure. How are you going to prolong it? What would your
Well,
recommendations
definitely
be?
you need. It's not a replacement for Botox. Nothing replaces Botox. Surgery doesn't replace Botox. Skin tightening doesn't replace Botox. Laser doesn't. And now it can make the effects of not doing Botox much better. But
What do you mean?
like if a patient has deep lines from not ever doing Botox or not doing any kind of cosmetic treatments, and then they suddenly come to you and they have a lot of deep wrinkles, a lot of fine lines, etc. The ablative procedure is going to be great.
Oh yeah, and then
But you still need Botox to maintain the effects of the new skin doesn't get super wrinkled again. So that's one thing to realize. It's not a replacement for Botox. Deep lines or significant volume deficits in the face, they have to be corrected with filler. If you have extreme skin laxity, obviously the patient, and I tell patients that are a candidate for face and neck lifts, I mean, if you're a surgical candidate and you'll get a lot of benefit from this, I don't make any money from this, but I want you to go see a surgeon because I want you to have the best outcome. Because if you keep doing this over and over and over, you're going to get some results, but at the end of the day, you're going to get a better overall result with surgery. So you have to be honest with patients about that. But with regard to maintaining the effects of a successful ablative laser treatment, I mean, I would do some, obviously, skincare. Good skincare is very important. Botox, and perhaps maybe a skin tightening treatment like Soft Wave is excellent, and repeating that treatment about once a year, I think is a good idea. Or doing fractional sessions in between, like if you do fractional laser, 2 or 3 times a year in between, which doesn't have much downtime. But
what's your take on microneedling with RF? Because that hit the market really hard with like Morpheus, and I don't know the name of the Candela device, but they have one as well. And then there was a bunch of backlash on it that came out with a bunch of different bills about the potential risks of RF microneedling. How do you feel about it? Do you think it has its place, or do you think you might as well just do like utilize a skin pen or something, go through a microneedling treatment, do something topical like PRP or VAMP or exosomes?
I mean, if you want to stick to microneedling, I don't see the place for microneedling as much anymore with the newer lasers. You could compare microneedling to like a fractional laser treatment because you're not ablating the skin completely. You're causing a bunch of micro injuries to the dermis. But I think that lasers can do that better than microneedling. However, if you want to combine microneedling with PRP, I think you still get good results with that.
What about with RF specifically?
The RF component, I think there's better options. I mean, first of all, it's pretty painful.
It's also expensive.
It's expensive. It requires multiple treatments. I think you can get to the finish line a lot quicker and easier, less expensive with laser treatments and skin tightening treatments. That's kind of like a combination of a slightly like a skin texture resurfacing tightening treatment. But you you're better to do singular modalities for each of those problems. Skin tightening with laser combo soft wave, or the ablative resurfacing for the skin texture, pore size, fine lines, pigmented damage type stuff.
Yeah, there are some great treatments out there, but I think sometimes some of the wrong ones get too much recognition, you know.
Mm-hmm. They had a
And
lot of great marketing for Morpheus, and that doesn't mean there
it
weren't
was
some
such
good results.
they were
But
trying to sell they were trying to sell me that device for like $80,000. Like that's what they wanted for it,
mm-hmm.
and I mean I just couldn't. It's too big of a bullet to bite for a device like that. You know, for something, and it's so. I don't know. I didn't like it. I mean, we weren't even.
Well,
We
all
weren't
the
even
patients
close.
that have come to me that have done it, I would say about 60-70% were not happy with the results. That doesn't mean their overall patient satisfaction is representative of that number, but
It also, you know, with that though, it depends on the practice, right? I mean, like, I'd like to think 99% of your patients are always satisfied, right? You've always got 1% that you just can't do anything about. Very rarely are we having a conversation where you're telling me that a patient isn't satisfied. You see a lot of patients, we see a lot of patients. And I think that just comes down to the care part of it, right? So you could have the best modality in the world and their treatment could still suck.
yes. Yeah.
Like I mean,
of course.
you know,
Same with laser hair removal
it's
or
same with all of
anything.
it. Yeah. So, and I think sometimes it comes down to that, you know, like it depends on the practice. It depends on the practitioner. Like we had a couple new hires start because the Vera location's almost open. So we're going through some hirings, and these are skilled practitioners, but they're all training through Jupiter just because it's the craziest location. And you know they're going through a lot and it's stressful, and these are individuals with experience, and they're just thankful for it. They're like, no one ever, I never knew it to be like this. You know, I was never, you know, it was never. And you know, I think it's because maybe all the different variables, right? So seeing so many different types of patients and then seeing so many different types of diagnoses or treatments or procedures performed, which helps. And I also think it's the way that, you know, they were all taught in Jupiter, and like how they have your support and how much you've taught them and all the wisdom they can continue to expand on, that turns them into such good providers, right? Because they were good when they came to us, but then it's just like it's like another notch up, you know. And I think that helps with patient satisfaction tremendously when everyone treats the same. And you know, sometimes there's always a patient that's like you know, they go from one location to another location, and then they come back. And if I ever see them come back, I'm like, what happened? Like, get me involved. I want to know why you want to come back. Like, that means something's wrong. And then it's addressed. But I like when patients bounce all over, because they, you know, everything is honored at every location, and when you have the same experience at every location, no matter the provider, that's how it's supposed to be, right?
That's interesting.
That brings joy to me. I'm like, you should be able to go see. And, you know, of course, there's patients that are on a personal level with their providers, right? To where it's like they're so, they feel more like it's very comfortable, right? They don't want to go anywhere else. But I like when they do. I don't mind it, you know, and that they have the same exact outcome, same exact satisfaction. That means something's being done right.
Yeah, no, that's an interesting thing if they're bouncing between different locations at your facility. But I mean, if they're going outside, it's also good feedback to see what went wrong if they go to a different practice completely.
I've only had a couple of those, right? But all with GLP-1s. It's all been with GLP-1s, right? Because, I mean, I don't think we're positioned competitively, right?
Yeah.
But here's the thing. The medication's expensive, but the overhead's a lot more expensive, right? When we're not just sending you a script, right? And I think that is that's the outlying factor, right? Is that they can just go online and just get the medication, and it's a lot cheaper. and we can't compete with that.
The medication may not be as good.
No,
right?
the efficacy could be different, but I'll never be able to compete with that. And I tell patients that. I've told patients that. I'm like, listen, I can't. Like, I can't. You know, it's like you gotta. These are brick and mortar establishments, and it's personalized care.
And they're coming in. They're meeting with the practitioner. They're getting the body composition test. I mean, there's a lot more to it. We've discussed this before. I mean,
a lot more to it. But you know, it'll forever be a popular topic on every episode until something in the industry changes. Well, like that's just like you know, when we were talking the other day about the whole plastic surgery requirement. If your practice veers more aesthetics, right? I mean, it doesn't correlate to knowledge of aesthetics. Doesn't correlate to knowledge of the industry.
And where do you draw the line?
Yes.
What if you have 4 wellness services and 1 aesthetic service? What qualifies you as a med spa? I mean, these requirements will never hold up in court.
But it also comes down to, you know, at the end of the day, right? Compliance is important, but patient safety, in my opinion, overrules compliance. It just does. I'll forever look at it like that, you know. I can't not. Well, you do, and I will make sure everything is always compliant, but at the end of the day, patient safety matters more. I'm like, listen, if you feel like that, I mean, like if it's a life or death scenario, I'm going to ask, if you feel like you're dealing with a patient and it's a life or death scenario, right?
Mm-hmm.
And it could be looked at as uncompliant, what matters more? Staying compliant and letting the patient die, or being uncompliant and saving the patient's life?
I mean, obviously, I would be non-compliant in that situation, but and I think at the end of the day, with the board of medicine and any regulators in the field will appreciate that standpoint. Is if you're always advocating for patient safety.
Yeah, but you've seen doctors that have been seriously penalized over stuff like that.
Yeah,
I mean, there's
look at the COVID pandemic.
Yeah,
I mean,
seriously penalized. Like they did everything right, and like even the patient could be an advocate for the doctor, and they're still penalized for it.
Yeah, you're right.
You know, like there's tremendous amounts of scenarios like that. Because they didn't follow the statute that was wrote 15 years ago, or the regulation, because they thought that it could be done better. Isn't that the whole purpose of medicine, right? From an MD standpoint, like you practice to see what's best fit.
Yeah, unfortunately, when you get a lot of, either you have old laws that get grandfathered in that aren't applicable anymore, or you get new laws that haven't stood this test of any type of reasonable scrutiny, that need to be modified. And like that, we saw that with the COVID pandemic. All this legislation, all these mandates came in that didn't really make sense, and turned out a bunch of it was nonsense. And a lot of doctors were ostracized for disagreeing with certain protocols.
You have any in particular, you know?
Not personally, but even American stage, there was a lot of very well-renowned critical care pulmonologist type doctors that were against a lot of the regulations and mandates and et cetera that were being pushed and forced on doctors and patients.
About it. I mean, that was $1 billion sickness.
Yeah,
Wasn't it?
And you get guys like Fauci that to this day have never been held accountable for all the nonsense they pushed into the public domain, and consistently, even after it was shown that a lot of this stuff was nonsense, they still stuck to their guns on it.
You know, and that's where it starts, right? I mean, I know we're veering out of aesthetic and wellness, but who is everyone's superior in the health realm? It's big pharma and insurance.
Unfortunately, that's who a lot of doctors are working for.
That's what it is.
I mean, it's a mistake to say doctors are working for big pharma, but at the same time, you know.
Let's talk about that for a second, though, right? I mean, you've got obviously it's changed a lot, but it's specifically within the opioid pandemic. I mean, you had sales reps that are like, push this medication, right? you'll be
I mean,
scrutinized if you're not
yeah,
pushing.
that was a little
And
bit before my
of
time,
course, but it's still
but
like that
yeah,
in every realm, right? This is the medication you need to push. It's what's best for your patient. That's how it is.
yeah. I mean, and it's the job of the physician to figure out which medication is most likely the best and which is, you know, and it's not like physicians these days get any kickbacks or any kind of reward for suggesting or recommending a certain medication. It
So
kind of used to be like that. I don't think there's any.
so from insurance, why I mean, now we're gonna hop back in the realm of aesthetic and wellness. Why are they like from regenerative standpoint? Why are you testing every lab marker in the world, sending and billing insurance for that?
You don't have to.
Why not just bill what's necessary?
It's well, again, the doctors don't really make any money off laboratory reports. The labs do.
Practices
The
do.
labs do.
The practices do.
Well, they typically are going to use an outside lab, and that lab will bill the insurance. But yeah, I mean, there's a lot of unnecessary testing going on. Some of it for as a defensive medicine to somehow cover your ass in case you miss something. But I mean, yeah, there's not a lot of reasonable criteria that goes into ordering certain tests. Some of them are absolutely nonsensical. Some of them have no effect on the patient's or objective reference to the patient's complaints or possible disease manifestations. So it's an absolute or really confounded system with a bunch of variables that don't make any sense right now, especially from regards to reimbursement and what's admissible in terms of billing.
You know what's crazy? I didn't tell you this yet. It happened this morning. I was at the gym, and everyone kind of works out at the same time. So you get to know people. You work out at the same place for years at the same time, and so I like to think of him as a friend. Borderline friend, acquaintance. He wants to come in for some aesthetic services. So it's like he's like, I want to come in this week. Can you get me set up for an appointment? I was like, yeah, of course. Do you also have like any recent blood work? They can take a look internally as well. If not, we can just do it for you. And he's like, yeah, I just signed up for this new subscription. I've got like a 40-page packet of lab tests. And I was like,
okay.
All right. So I'm like, that's just, they sold them on this like more is better.
Yeah.
They sold them on more is better.
That appeals to a lot of people because they think
that happened this morning. Like that was this morning. There was a conversation this morning. And
what is this, like a online thing or
we didn't get into it too much, but I'm gonna ask him, figure out what type of subscription it was or what exactly he's paying for this massive 40-page packet of tests that I don't know how that would be necessary. I mean, do you think you would know? Like, you think that for what in what realm?
I mean, I don't know what's in there. I mean, it could be a combination of food sensitivity, food allergy, a bunch of nutrition markers, a bunch of cancer screening tests, which aren't actually suggested for screening.
What do you mean by that?
Well, there's a bunch of cancer or tumor marker tests that can show the evidence of cancer, but they're not diagnostic at all. They're traditionally used to measure the effect of treatment of cancer, where you'd see a certain marker diminish in value as they receive certain chemotherapy treatments. Now they're saying, well, we're going to order all these tests, and if any of them come back high, then that means you have cancer. No, it doesn't mean you have cancer. It means you're going to go down a rabbit hole of investigational studies to determine if you actually have cancer, or it's an outlier, or it's due to some other thing. There's the positive predictive value of a lot of these markers is not high. So that's why we use them. We haven't used them as a screening test, but now they're being used that way because it makes patients feel better about getting screened for cancer. So that's the problem with a lot of these. If you don't have a focused approach or a logical approach to ordering tests from a patient, you can send them down a rabbit hole of a whole bunch of, first of all,
Shouldn't
unnecessary anxiety.
shouldn't there be a diagnosis? Like, because what it seems, what I always thought it had to be, right, was you have to test off of what is prescribed. So like you see a practitioner, you fill out, you have a medical intake on file that a practitioner reviews, and then they dictate what tests they think are best because you're
Exactly.
symptomatic in some realm,
Mm-hmm.
right?
Mm-hmm.
But now it's like people are just testing whatever.
Yeah, like they call it like a wellness panel.
Yes,
right?
but shouldn't it be you have an intake packet and an exam can dictate a lot and outlie a lot, right? Because a formatted intake packet is going to put you through a bunch of questions. It's going to help the practitioner be like, this is what I would test, this is not what I would test. And then based off your responses, they can make, their medical judgment on what tests are going to be better for you and what tests they think are going to be completely irrelevant.
Exactly.
But now it's just like, let's get
Well, and
101
also
tests
a
completed.
a typical wellness examination would consist of really a set of basic tests like a CPC, a CMP, lipid panel, etc. But now they're branching out to this wide range of tests, which have a lot of false positives, whether it's tests for autoimmune disease, tests for cancer, tests for
Could you really know,
inflammation,
though? Like, would you
etc.
really know? And like, if you don't have
No,
allergies, if you've never had a reaction to food or something externally, why are you going to test for allergies?
that's the point. I
You
mean,
know, like,
there
what's
has
up?
to be a logic in it, because then the patient gets this abnormal finding back, like, oh, I never had a problem with milk before, or dairy, or cheese, or a certain type of grain, and like, oh, well, what the hell's going on here? Maybe I need to go see a GI doctor. Now I'm going to eliminate this from my diet. Maybe you don't
No,
have
but
to.
they don't go see a GI doctor. They go back to the practitioner that had all the tests. And then what do you think their advice is? To go see a GI doctor?
They'll send them out to another
Because,
doctor.
like, if I was a patient, I wouldn't be like, oh, I'm going to go see a GI doctor now, right? That'd be an educated patient to know, go and then.
Yeah, but I mean, I'm just saying, like, I've seen it a lot of times. They have these fancy tests. There's this one test. You send a stool sample in, and they run it for all these different antigens and antibodies and sensitivities, etc., even digestive enzymes, etc. And these patients come in with certain symptoms, and now they've been diagnosed with all these problems, all this specific type of H. pylori, a specific type of
Make me anxious.
pancreatic deficiencies, etc. And then they're on these new diets. They're losing tons of weight. They become anorexic. They're doing nonstop follow-ups with the GI doctor, and they're getting weaker and weaker and thinner. And this could all have been negated by just avoiding the test in the first place.
I would be pretty anxious. You borderline. I feel like you could become into a depressive state at that point.
Oh yeah. I'm telling you, it's like severe. It can be severely impact the patient's health to the point where they become anorexic and malnourished. I mean, that's an extreme example, but it happens all the time. Just like you can get an abnormal finding on pathology. If the pathologist reads it incorrectly, a patient may have an unnecessary surgery to remove the supposed cancer, which wasn't cancer at all. So that kind of thing happens a lot. People don't realize it, but it does, because there's a significant gray area that exists in the realm of practicing medicine.
Can we talk, since we're speaking about wellness, I want you to talk about putting the body through a cryogenic state properly, full body. Benefits.
Well, the benefits are going to typically be manifested through your body's response to receiving almost a shocking level of a reduction in temperature over a small period of time.
Well, so hold on. We've got cold plunges, right, which are very popular right now, and we have.
They certainly have their applications. I mean, I
And
would
we have
say
full body cryotherapy where you can go get in a chamber that goes, up to negative 220 degrees.
and they
For
all work
an
on the same idea that
3
you're going to
minutes.
reduce the body's inflammation,
Why do one over the other?
inflammatory response, because due to various concerns, whether it's injury or a general inflammatory state, you're going to reduce inflammation, and you're also going to increase blood flow to the peripheral tissues. That's in response to the cooling of the skin, and your core body temperature remains the same, but your skin and your extremities are decreased temperature, so your body's going to respond by opening up all those blood vessels and surface blood flow. So that can manifest in maybe providing more blood flow and oxygenation to tissues that weren't receiving enough in the first place, increasing blood flow to extremities and peripheral tissues, as well as reducing inflammation. So all those things.
How many times a week would you do it? Would you do it
People that
multiple
can do it
times?
every day.
Every day?
Yeah, I mean, especially people that they're putting their bodies through a lot. I mean, professional athletes, I think, do cold plunges every day.
Why pick one over
Now,
the
why
other?
would you pick a cold plunge versus a cryo treatment? One, you get obviously exposure to a much lower temperature.
What do you
with
think's
cryo.
better? You think one's better than the other?
I don't know if one's better than the other, but I mean, a lot of people cannot tolerate a cold plunge. I can't. I couldn't do that. That's too shocking for me.
More shocking than.
Oh yeah, more
Really?
shocking than minus 200 degrees Fahrenheit for 3 minutes.
Why do you think that is?
Because it's just, I don't know. I've never been great at going into really cold water. I haven't, whether it's a lake or an ocean, I hated that. That was detestable.
And you're okay with the cryo?
I'm okay with the cryo because it's only going to be a few minutes, and it's not even.
So cold plunge can
It's
only be
not
a
as
few
cold
minutes
though.
too,
It doesn't feel as cold as the water. I mean, the water is shocking. And the other benefit is you don't have to get wet, so you don't have to change all your clothes, you don't have to dry off, etc.
But you have to come out of your clothes, yes.
Yeah, you have to take your clothes off,
But you don't have to dry off.
but you could leave some clothes on.
Yeah, I guess it
I
could
mean,
be
if you came in, for example, if a woman came in a sports bra and sports shorts, I mean, shorts, that's fine. You can wear that.
You don't have pants and all
Yeah,
that
you just
shit.
don't wear pants and shirt.
Yeah.
But I think getting wet is kind of a pain in the ass for some people. I don't prefer getting wet. And I think there's a different experience when you're standing and just you just get shocked by all this cold air, and from a clinical standpoint, I mean, your skin actually remains at a lower temperature for a longer period of time. I'm not sure why, but even like 30 minutes later, your skin will be slightly colder to the touch than, say, you did a cold plunge.
Do you think there is an immediate improvement in, basic functions, energy, sleep?
Well, I know a lot of people claim after cryo chamber treatment, I mean, they feel invigorated because, I mean, first of all, it's a little bit of a shock to the body. It responds by producing all this, maybe a little bit of adrenaline, and also it increases your blood flow and heart rate, etc. So, you might feel more cognitively
Immediate,
alert.
yeah.
You might feel more energetic, etc. for the rest of the day.
It's great. There's a lot of options out there, right? You have electric chambers, you've got liquid nitrogen chambers, and you've got non-full body chambers. Like you could.
Those are the most common. Most people that have had a cryo chamber treatment are usually the ones that go from the neck down.
And why do you think that is?
That's just how it started.
It's just cheaper.
Yeah, that's how it started. The early cryo chambers were like, from the neck down because they didn't want to expose the face and head to the severely low temperatures in the nitrogen. Now, like with full body nitrogen includes the head, you walk into a small container,
Small box.
and the whole room is cooled, and in that.
Yeah, but the nitrogen's exhausted out. And
Yeah,
only,
the nitrogen
it's only
doesn't touch
oxygen.
you directly.
Yeah.
It just cools the air in the chamber, and then with versus electric chambers, the temperature can be much lower in a nitrogen chamber. I think it was low as minus 220, whereas typical electric chambers are minus 160 to minus 180.
And do you think
Fahrenheit.
that 50, 60 degrees is a big
Can
difference?
make a huge difference, yeah.
Yeah.
So that is the one thing. They're typically colder, the nitrogen full body chambers, than electric chambers. A little bit more difficult to operate in the sense that the nitrogen is a heavy consumable, whereas electric chambers,
No consumable.
no, except electricity.
Yeah, it's your FPL bill anyways. You get paid regardless. It's pretty advanced that someone developed. And there's great chambers that come from, where is it? Poland. It's kind of ironic. That's where they're made, right?
The cryoscience, yeah.
It's a great chamber. I haven't done too many of them, but I feel an immediate energy rush after it.
Yeah.
Yeah, more alert, like right away. It's hard for me to even make it through.
Have you done a cold plunge? You seem like the kind of guy that would have done a cold
not
plunge.
Not really, because it kind of grosses me out seeing a bunch of people get in and get out of it. But I'll take cold showers in the morning, but that's not nearly as cold.
Even I have a problem with a cold shower unless I'm super hot.
When I can't. I like in the mornings. I've read a couple things that mainly.
I'm not saying it's not a good idea.
Yeah,
I just don't. The idea is shocking.
There's studies that I've read that show like if you get up and immediately go take a shower and it's hot, it's negative on your body. I have no reasoning behind that, but I remember seeing an article on it. It just seems like cold is better for you. So all of my showers in the morning are lukewarm, too cold. Like the last 30 seconds will be freezing cold. But
so like before you get out, you'll turn it all the way down.
All the way down.
Okay, that's a good idea. I should try that.
Do it as long as I can stand it for, and then I get out. But no, so I'm not a big cold plunge person because of that, unless you have one at your house. Maybe it's like private.
Yeah, most people typically.
I can't do it in the gym. I won't get it in the gym. And but the cryo chamber, I can't go past beginner mode. I'm just. Have you ramped it up?
No.
No. It's it's freezing, dude.
I know.
I could barely, and it's like you're talking like 2.5 minutes. I don't like the cold at all, and it is freezing.
So you're like really counting the seconds?
I'm counting. I'm watching the monitor tick down. It's like the longest minutes that I put myself through. It's a lot. I don't know, and I can't do it every day. Like I won't. But there's I see immediate benefits versus like hyperbaric. I've probably got like 15 sessions under my belt now, and I've noticed improvement, but not tremendous yet. It keeps the inflammation down in my knee that I've noticed, though.
Well, how many have you done? Cryo treatments?
Cryo or hyperbaric?
Cryo.
Not a lot.
Not a lot, just a few.
3.
Okay.
Hyperbaric, like 15, though.
Okay.
And I see...
Yeah, it's going to be a slow improvement there.
It's like what
you're not dealing with an acute illness. You're dealing with a chronic illness, and that. I mean, you will probably see some benefit, but it'll probably take at least 30, 40 sessions. Well, my surgery's
Friday, right? So I mean, I should probably be in it.
Yeah, get in it every day before your surgery, right? For sure.
And then after, should help with the healing process.
For sure, that'll be great.
When's the last time you were in your hyperbaric?
I just did a treatment.
Can you do it on your own?
You can, yeah.
You're able to?
Yeah, I just never got into it, but it does have valves on the inside to
depressurize and pressurize it.
Yeah. So you could do it on your own.
Is it mechanical or electronic? I forget. I think I haven't seen it in so long. The valves, electronic or mechanical? All
mechanical,
of it? Yeah. When's the last time you did one?
Oh, it's been a while.
Why?
I don't know. I'm not good at managing my time. I should just get used to going in there and doing all this shit inside.
It's so beneficial. I mean, like, it's in your backyard, right? You'd think, not actually in your practice, but you'd think you'd always do it, no?
Yeah, I know you would. I'm going to get into the habit of all of them. The contrast therapy, too. The only thing you're missing there is a really good red light bed. That's the next.
They're so expensive.
I know.
I
Well,
I
we got to
mean, like,
find one. We got to find one
I know,
and,
you know,
and
and
get it
I
going.
can't buy it, and like I've seen these practices buy these absolute
Oh yeah, there's so many shitty
dog
ones.
beds, like they're just so shitty, and I can't bring myself to do that. I'm not gonna do that. If I buy it, it's one of the, you know, it's 7,200 net to 9,600 joules plus, right? Similar stuff that you have. You've kind of brainwashed me in that realm. I could never do anything less, right? I mean, it seems you've convinced me on, especially with the beds with the like the LED strips, you know. I'd feel like it'd be unfair to patients. So when we do acquire one, which we will, or multiple.
Have you ever done one at my facility, the
No,
red
but
light?
no.
Oh, you should try it next time you're here.
No, I don't think so. We flicked
Yeah.
we turned it on that one time though, or multiple times, and for those photo shoots or whatever we were doing.
Oh yeah, that's right.
It's bright, you know, but
Sure.
never done it. What do you think? What do you think you should be?
I think that's good to pair with hyperbaric
And you think
or cryo.
you're doing all of it daily? Like you come in, you could do all of it. You could cryo, red light, hop in the hyperbaric, fine.
Yeah.
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 Okay. No issues.
The order I would do it in is cryo, red light, hyperbaric.
And and eventually hyperbaric would fall off though, right? Because of the oxygen toxicity. When would you stop?
Well, it depends on what atmosphere you're pressurizing to and how often you're doing it.
You're going
I
up to
mean-
2 atmospheres daily.
Oh, well then, yeah, eventually you'd want to reduce the pressure.
You know what though, and I was a little, I kind of dove in with this company for a little bit. You're 1 atmosphere above our atmosphere. That's 2 atmospheres, right? You're at 2 atmospheres above our atmosphere.
Yeah, like the total would
And
be
I think
3
that's a
atmospheres.
common misconception. Individuals think you're 2 atmospheres above our current atmosphere, which you're not.
No, it's total the pressure.
Yeah.
Now, that we used to say like 16 pounds per square inch is the typical atmospheric pressure at sea level. But now we talk in ATA and kilopascals and stuff. So that's the old school way of thinking about it. I remember my
You
dad
still think
telling me
about
that.
it in ATA, I think, yeah. In KPA.
Yeah. When
Yeah.
you think of like 16 pounds per square inch as 1 atmosphere.
Well, I've never thought of it like that. No, I've never
That's
thought
the amount of pressure on one square centimeter of your surface.
Okay. You know, it's my favorite.
It's a lot of pressure.
It's my favorite piece of
I
technology.
mean, just atmospheric pressure is a lot of pressure. People don't realize that's why we go into a vacuum like space and we will basically explode.
That's the same with, going to when you're diving, right? Pressure gets more compressed as you get deeper.
Yeah.
Yeah. It's the most exceptional treatment. I think it's so relaxing. I think it's great. If you could dedicate the hour and you actually have the hour to put in, and like you can have it. So also, obviously there's a lot of hyperbaric out there that's just being sold. It's not being prescribed. It's another thing that I think should be prescribed, not just like lab work, right? You should have an intake.
I mean, there's a whole
cleared.
area of medicine called hyperbaric medicine.
Yes.
And there's doctors that literally, that's all they do, specialize in that one thing. I'm not saying that it's all that complicated, but for maybe they're experimenting with different things. Like one of the new things is where you go from like 100% oxygen to room air oxygen, like 21%, for a period of time, and then go back to 100% oxygen. There's studies on that.
Oh, like 25 minutes on, 5 minutes off,
exactly.
25 minutes on, 5 minutes
Yeah.
off. You know, that's what I do every time I'm in it. I haven't done it any other way. That's Dr. Frati's protocol. That's his protocol, that is. He's like the godfather of hyperbaric, I guess. That's what Oxygen Health System, that's all they talk about is him. That's the only, like in all the trainings, all the stuff that all the providers, the whole company went through, that's everything they're talking about is his protocols. And how it's hyperhypoxia. I might be saying it wrong. That's 25 minutes on, 5 minutes off, 25 minutes on, 5 minutes off.
Yeah. Hyperoxygen.
And you know what's crazy is that I feel like I get more oxygen when I'm using a cannula because it's so direct versus when I'm using a mask and I'm going up in pressure. Because I feel like it, if I just put the mask on and the chamber isn't pressurized, it's a lot of oxygen. But as I go up in pressure, I don't feel as much oxygen.
That's why you need a non-rebreather.
Yes, but they say you don't need
I
that.
mean, I don't know. I mean, everyone has a different opinion on that. But I mean, if you see that 100% O2 bag full, I mean, why not?
You think it's that much more beneficial to where you're using a
Well, that's what they recommended.
You think it's based off of chamber or no?
No, pressure's
Is right?
pressure. Pressure's pressure.
I don't know why they would do that then. Yeah,
Mm.
maybe we're going to have to do that. But when it's utilizing a nose cannula, like it'll dry out my nose completely. I feel like it's so direct.
But if you look at all the studies on nasal cannula, it works out to like 80% or something.
Versus, yeah.
Yeah.
Yeah, but again, that's someone's opinion, right? That's what it. No,
I mean, that's a fact, I think. But yeah, the difference between a regular mask and a non-rebreather, I mean, non-rebreathers exist for a reason.
Do you think that's the reason?
Mm-hmm.
That's a pretty good idea. Now I'm thinking about it.
Mm-hmm.
I think that's probably.
I think we're getting too technical.
Not really, though. I mean, healthcare is technical, right? I don't remember using a non-rebreather at your practice. I don't know why I can't remember it.
Yeah. That picture you have of me, that's with a non-rebreather.
Yeah, but I don't think I had that on. I don't think you gave me one. When I went and
You
did
sure?
it. Yes.
That's all we have.
I know, but I'm almost 100% positive. I just didn't see it when I was doing the treatment.
That's weird.
I don't know. It doesn't make any sense, but I love everything wellness. I think the industry's, when it's done right, it's great. What do you think about these like full body scans that people are doing, like big MRIs almost, that it's like scanning everything? I see a lot of practices acquiring that. There's a couple that just opened up that.
Yeah, I
are
mean,
doing it.
I think it's a good idea. I mean, there's what they say, they have a 17 to 19% discovery rate on an asymptomatic patient. They find something that needs to be looked at and investigated. But again, take that with a grain of salt because, there's a lot
What
of
if it was
anxiety.
0% though, right? I mean, the piece of equipment would never sell.
Yeah, I mean,
like, don't you have to
of that 17 to 19%, how much of that actually leads to a positive diagnosis that got early treatment?
What do you think
maybe
that is?
5%,
Yeah.
2%, 5%. But still, I mean, people don't want to. I mean, if it's going to give them some peace of mind, early detection of cancer is the main focus on these full body MRIs. Of a cancer that hasn't manifested to the point where it's causing clinical symptoms. And if you catch it early enough, it's obviously much easier to treat.
What's crazy is with how big the wellness space has gotten, because a lot of my friends have reached out and they're like, can I come in for a visit so I can see if I can be put on peptides?
Yeah.
I'm like, the fact that that's like that's life now. It's really what it is. That's how big the industry, the wellness and aesthetics industry has gotten. I mean, like, you feel like you're being left behind if you're not doing something. It was a FOMO, right? Like, you feel like you could be doing so much better, whether it's in the gym or appearance. And
that's true.
And people are just buying whatever they think. It's just get it diagnosed. I mean, I think that's the best, safest way to do it. But thanks for tuning in to Inside Out Med.
All right.
We'll see you next week.
Sounds good.